Interesting Medical Facts Part 57. There's something called polypharmacy, where a patient is taking too many medications, and whereas you might think that helps the patient, the reality is taking too many medications compounds the side effects and ultimately leads to a worse quality of life. Now, this doesn't only just happen with regular prescription medications, but this can also happen with supplements that people take. The tricky part about supplements is that you can go to whatever pharmacy and you can buy whatever supplement because oftentimes these are not FDA regulated. And you might think, well, if they're benign enough to not have to get FDA regulated, then that means I can kind of take it however I want. And the reality is you can have one active compound interact with another active compound. So if you take, for example, a cholesterol medication, sometimes if you buy something over the counter that's a supplement that you think is natural, it could very well interact with that medication, or the cholesterol medication might interact with that herb or vitamin that you're buying over the counter, and it can lead to dangerously high levels of one or the other. That's why when you go to your doctors, it shouldn't just be a conversation about what medications you're taking, but also what supplements you're taking. Because again, it can appear as a benign herb or vitamin or something that you're buying over the counter, but there are very real interactions that happen. It doesn't happen often, but when it happens, it can cause more problems.